Thank you very much. We are very enlightened by your introduction. We can just start by going through the types of mental health problems and then move on from there.
All right. So let's start from what we call the maternal blues. I think that is quite popular. A lot of people have heard of maternal blues. Maybe the name, they like the name, so a lot more people are aware of it. But you know, about half to 2/3 of women who have a normal baby. Here we are talking about the outcome of the baby, not the delivery itself.
Okay.
They experience you know, increased irritability. They experience what we call, in layman terms, we'll call it mood swings. So one time they're very excited about their baby, you know, they don't know what to do, and then the next time they are overcome with such misery. It's like, what is happening, you know? And it's common. It's very common. It's not linked to the type of birth that you have. It's not linked to your birth complications or anything like that. And oftentimes, such women, you know, it occurs 2 to 3 days after you have delivered.
Okay.
And for most women, it goes away with continued observation and support from family, from friends, and their doctor. You know, it goes away after a while and they are fine. They can continue with their life, bonding with the baby, being excited about the baby.
Okay, so Dr. Marfo, this maternal blues, what are some of the causes of it? Is it because all of a sudden your life changes? Your life now depends on this new person who has come. Your schedule is dependent on whether this child wakes or sleeps. Before you delivered, you could sleep, let's say, 8 hours in a day, but now you're sleeping 1 hour or 2 hours. Some babies are very troublesome. Sometimes every 30 minutes they are up, and all that with the whole stress of breastfeeding, family members around. What are some of the causes of this maternal blues, and then what are some of the ways that these women can deal with it to prevent them from progressing?
Certainly. You know, maternal blues is common in first-time mothers, and as you rightly said, there's a lot of adjustments that goes on through that period, during that period, you know. A lot of social adjustments, a lot of physical adjustments, and the lack of sleep is one thing that, you know, nobody really prepares you for.
Every woman.
Yes, nobody really prepares you for. So, you know, some school of thought believe that it's because of the hormonal changes that occur during that period. You know, after delivery, there's a drastic reduction in your estrogen, progesterone levels, as well as cortisol, and this usually occurs around the day 2 to day 3. And maternal blues also, you know, starts around that period, day 2 to day 3. So some school of thoughts feel that probably is as a result of the hormonal changes that go on. But you know, when I talked about the incidents, it doesn't occur in every woman. So some other school of thoughts believe that probably it's not really the hormonal changes that go on, but in some women, they are more sensitive to the hormonal change that goes on, you know, the drastic hormonal changes that goes on during that period. And that may, you know, make them more susceptible to maternal blues. But when it comes to mental health, you know, everybody and what they find challenging, everybody and what will be a stressor for them. So for some women, all these changes, all these things that's going on in their life will not really have much effect on them. But for other women, no matter the support that they have around them, it's a big change, and you know, they are not able to cope too well with it. So they will experience the irritability we talked about, their mood swings, and then they will have a lot of crying spells. So the thing with maternal blues is that it's not as if they are really depressed. I mean, we are not going to say that this person is depressed, but they have some mood disturbances because of what they are going through. So they experience a lot of tension as well. You know, they cry a lot. It's a lot for them, everything that's going on. Yes, it's a huge change, it's a lot. And it often, you know, lasts about 1 to 2 days. So it's not
oh,
something.
Is that short?
Oh yes, it's not something that really prolongs.
Okay.
You know, yes, it's not something that really prolongs. So with a little reassurance, midwives are very good at, you know, picking up maternal blues. Okay. So if you are still in the hospital, they will pick it up, or if you're having regular visits, they'll pick it up. So once the person is reassured that this is what you are going through, we expect that it will pass and all that, there isn't really anything that we do for you. We observe because we expect that it will pass, and the mother should be fine and continue bonding with her baby. You
see, when we watch movies, it looks like as soon as you deliver, there's a whole beautiful bonding period between the mother and the child. In reality, it doesn't happen. Is it also, can it also be due to that expectation of what they see in movies compared to the reality of what actually happens after discharge from the hospital? You come home and you don't have enough sleep and this baby is demanding all it is. Can it also be a contributing factor to the maternal blues?
I mean, yes. That's why it's commoner in first-time mothers, because this is not something they've experienced before. And this is, the reality is so different from your expectations. So we have all these things going on. And basically, you don't know how to cope. You are now still trying to adjust. It's like the transition to motherhood is
very sudden.
Yes, it's very sudden. It's like a crash course, and you are not really prepared for it. You know, you don't get time to. It's not like pregnancy. We took, you know, 9 months for your body to adjust. This one is like a day's event. Maybe probably not even a day, depending on how long your labor was, and you were a mother with no experience. You don't have any manual, there's nothing, and you are expected to cope. So it's like whilst you are still trying to catch your breath, and then there's this baby, you know, demanding your attention and all that. So for some women, it's quite a lot, and some are able to sail through. You know, they don't have any mood disturbances, but for others, they may have mood changes just because of probably their genetic makeup. Yes, and then we need to observe them for some time and see if it will pass.